Hey everyone, let's talk about something super important. Access to therapy and counseling. Mental health services are a key part of public health. But even with growing awareness, a lot of people still can't get the help they need. According to the World Health Organization, almost 1 billion people worldwide live with a mental disorder, but more than 75% of them, especially in low and middle income countries, don't receive any treatment at all. Wow, right? So why is therapy still out of reach for so many? It boils down to a few big issues. First off, geographic and economic disparities. Where you live and how much you make can really shape your access to mental health care. In rural or underdeveloped areas, the number of trained mental health professionals is shockingly low. For example, in sub-Saharan Africa, there's less than one psychiatrist for every 100,000 people. Even in high-income countries like the US, cost remains a huge barrier. Around 42% of adults with mental illness say they can't afford treatment. And insurance coverage, it's often inconsistent and limited. Then there's stigma and cultural barriers. Stigma around mental illness is still a big deal, especially in some cultures. A recent study highlighted that in places like South Asia and the Middle East, cultural beliefs often discourage people from seeking therapy because of fear of shame or social isolation. But it's not all bad news. There are some innovative solutions making a difference. Teletherapy and digital platforms have taken off, especially with the COVID-19 pandemic. Services like BetterHelp and Talkspace are filling in gaps, particularly for folks in remote areas. Studies have shown that teletherapy is just as effective as in-person therapy for most anxiety and depressive disorders. In low-resource settings, task shifting is another promising approach. This means training non-specialist health workers to provide basic mental health care. In India, a trial showed that community health workers significantly reduced depression scores in rural populations. AI and mental health chatbots like Wobot and Wyso are also stepping in. They're not a replacement for human therapists, but they help with initial screening and provide cognitive behavioral support. Early findings suggest these tools can reduce symptoms of anxiety and depression in mild cases. Governments and international agencies are starting to recognize the importance of mental health. The World Health Organization's Mental Health Action Plan for 2023-2030 is pushing for integrating mental health into primary care, increasing investment in mental health services, and expanding digital mental health infrastructure. But without sustained funding, education, and systemic reform, access is going to remain uneven. So, where do we go from here? Improving access to therapy and counseling isn't simple, but it's possible. We need to reduce cost barriers, tackle stigma, expand digital services, and train local health workers. With smart policies and innovation, equitable mental health care can become a reality rather than a privilege. Thanks for listening. If you found this helpful, hit that like button and subscribe for more content like this. Take care, everyone.